Hello everyone and welcome. Today we're diving into a common yet often painful eye condition, corneal abrasion. We'll explore what it is, what causes it, how it's diagnosed and treated, and what you can do to protect your precious vision. So, what exactly causes a corneal abrasion? Simply put, it's a scratch or scrape on the cornea, the clear, protective outer layer of your eye. Common culprits include accidentally poking your eye, rubbing your eye too hard, especially if there's a foreign object like dust or sand in it, wearing contact lenses incorrectly or having a damaged lens, or even from something as seemingly harmless as a tree branch brushing against your face. In some cases, even dry eyes can increase the risk of developing an abrasion. Let's talk about what actually happens when the cornea is scratched. The cornea is densely packed with nerve endings, making it incredibly sensitive. When an abrasion occurs, these nerve endings are exposed and irritated, leading to significant pain. The body immediately initiates a healing response, sending inflammatory cells to the area. This inflammation, while necessary for repair, also contributes to the discomfort and blurred vision often associated with corneal abrasions. Small abrasions typically heal quickly, but deeper ones can take longer and potentially lead to complications. Corneal abrasions are quite common, affecting people of all ages and backgrounds. However, certain groups are at higher risk. Contact lens wearers are particularly susceptible, as are individuals who work in dusty or hazardous environments. Children are also prone to abrasions due to their active lifestyles and tendency to rub their eyes. There is no significant gender or racial predisposition, making it a widespread concern. The symptoms of a corneal abrasion can be quite noticeable and uncomfortable. The most common symptom is a sharp, stabbing pain in the eye, often described as feeling like something is stuck in your eye. Other symptoms include excessive tearing, redness, blurred vision, sensitivity to light, photophobia, a gritty feeling, and headache. You might also find it difficult to keep your eye open. Diagnosing a corneal abrasion usually involves a trip to your eye doctor. They'll start by asking about your symptoms and how the injury occurred. Then they'll perform a thorough eye examination, often using a special dye called fluorescein. This dye is applied to the eye and illuminated with a blue light, which makes any scratches or abrasions on the cornea appear bright green. This allows the doctor to accurately assess the size and depth of the abrasion. While corneal abrasions don't usually have distinct types, in the same way some diseases do, they can be classified based on their severity and cause. We talk about superficial abrasions, which are shallow and heal quickly, and deep abrasions, which penetrate further into the corneal layers and require more careful management. Abrasions can also be classified by their cause, such as traumatic abrasions from a direct injury or recurrent corneal erosions, where the epithelium doesn't properly adhere to the underlying layer. Treatment for corneal abrasions typically focuses on pain relief, preventing infection, and promoting healing. This often involves antibiotic eye drops or ointment to prevent infection, lubricating eye drops to keep the eye moist and comfortable, and sometimes pain medication to manage the discomfort. In some cases, a bandage contact lens may be used to protect the cornea and aid in healing. It's crucial to follow your doctor's instructions carefully and avoid rubbing your eye to prevent further damage. Prevention is always better than cure. To reduce your risk of corneal abrasion, always wear appropriate eye protection when working in hazardous environments or participating in activities that could cause eye injury. If you wear contact lenses, make sure to follow your doctor's instructions for proper cleaning and wearing schedules. Avoid rubbing your eyes, especially if you feel like something is in them. And if you experience dry eyes, use lubricating eye drops regularly to keep your cornea healthy and less prone to injury. The prognosis for corneal abrasions is generally excellent. Most superficial abrasions heal completely within a few days with proper treatment and without any lasting effects. Deeper abrasions may take longer to heal and could potentially lead to scarring or other complications, but this is relatively rare. There's ongoing research exploring new ways to promote corneal healing and prevent complications, including the use of amniotic membrane transplants and specialized growth factors. The future looks bright for even better treatments for corneal abrasions.